Introducing the next generation carefusion surgical clipper, which built on our industry-leading product and features enhancements for improved safety and efficiency. After months of research and input from consulting clinicians on how to improve our surgical clippers, we have crafted an enhanced design to meet your preoperative hair removal needs. The carefusion surgical clippers quickly remove hair, often in a single pass, helping reduce the risk of compromising the skin when compared to traditional razors. The new 40-degree angled ergonomic handle is easy to grip and designed to help reduce variability between clinicians when performing hair removal. Updated button technology simplifies clinician use and eases cleaning. Durable external material increases compatibility with most commonly used disinfectants. Damage to the patient's skin due to nicks from traditional razors creates increased potential for infections. It's important to note that the damage may not be visible to the naked eye. Increasingly, hospitals are adopting an approach known as a bundle in infection prevention initiatives. Bundles refer to groups of scientifically validated processes used for treating certain conditions. According to multiple studies, bundles demonstrated lower infection rates when surgical clippers replaced traditional razors. With gloved hands, position the appropriate clipper blade on top of the clipper head, aligning the marks on the side of the blade with the opened end of the arrow on the handle. Slide the blade in the direction of the arrow toward the dot until it clicks into place. To effectively clip hair, hold the clipper with gloved hands at approximately a 40-degree angle to the patient, with the logo facing up. Hold the clipper's handle between your thumb and forefinger as you would hold a pen or a pencil, or with a standard overhand grip. Gently glide the face of the blade against the surface of the skin, allowing the blade to operate efficiently. It is not necessary to apply significant downward pressure to the carefusion surgical clippers to obtain a smooth surface. With any surgical clipper, it is typical to have some short stubble remain post-clip. The efficiency of the carefusion surgical clippers allow close clipping, often with one pass. Remember to hold the skin taut with one hand while clipping with the other, ensuring a smooth surface for clipping. This is especially important when clipping areas of loose skin. Always rest the base of the clipping blade flat on the patient's skin. Do not change the angle or toe in the blade in an attempt to get a closer clip. Be sure not to use an overhand hold, as this will provide less accuracy and control. Always move the clippers away from your body with a gentle push. It is recommended that you do not pull the clippers toward you across the patient's skin, as this can modify the most effective clipping angle. Also, remember to never apply greater force than needed. Allow the carefusion surgical clippers to do the bulk of the work. 3 easy-to-change clipping head designs cover all your clipping needs: the Neuro blade, the SensiClip blade, and the general purpose blade. Each blade type can successfully be used clipping wet or dry. Wet clipping helps minimize potential contamination by helping control hair dispersal, and wetting hair with warm soapy water also makes it softer and easier to remove. The general purpose blade provides an effective solution for most procedural hair removal, quickly removing all types of body hair while leaving the skin intact. The specially designed Neuro blade is made for use on the scalp, cutting through even the thickest head of hair in a single stroke. The Neuro blade provides easy maneuverability, so you clip only what's necessary. When using the Neuro blade, hold the blade like you would the general purpose blade, resting the base of the blade on the patient's scalp and clipping against the grain of the hair. The SensiClip blade features a unique narrow design, providing easy maneuverability for even hard-to-reach areas without catching on loose skin. When clipping the groin area, place the patient in a frog-leg position to increase access to the area, with their knees slightly flexed, thighs externally rotated, and the soles of their feet resting on the tabletop. Hold the clippers like a pen or pencil, resting the base of the blade on the patient's skin. It's important to stretch the skin to achieve the safest optimal clip. Use caution when using the blade to avoid nicks from any inconsistencies such as skin tags or loose skin areas. The thin blade helps increase maneuverability, but it may be necessary for the clinician to change positioning to achieve optimum ergonomics. Removing the carefusion surgical clippers blade is as easy as a single push with your thumb. To remove the blade, turn the clippers off, position the clipper blade facing downward over a sharp trash receptacle, and use your thumb to push the blade forward along the blade frame. It is important to disinfect the clipper handle after each use. To clean the clippers, wash the clipper handle thoroughly with soap and water after every use, and wipe the device with a commonly used surface disinfectant. Or soak the fully submersible handle no more than 1 meter deep in an antimicrobial agent for up to 30 minutes. Avoid the regular use of disinfectants containing benzyl alcohol, which can cause chemical damage to the external housing and may void the product warranty. Finally, rinse the clippers under running water and dry them with a clean towel. Clippers store easily in a two-piece drop-in charging system. The new charging base can be easily disassembled, allowing convenient cleaning. After each use, be sure to place the clipper handle in an upright position in the charging adapter to ensure it is charged for the next procedure. Our lithium-ion battery technology facilitates longer runtime and improves energy efficiency. A flashing blue indicator light alerts clinicians when they have approximately 5 minutes of remaining runtime. The clippers have an expected runtime of approximately 120 minutes following a full charging, providing ample time for even the most challenging hair removal. Store the clipper handle without the blade. It is recommended that clinicians unplug the charger from a power source when the solid orange light is no longer illuminated, indicating the device is fully charged. Thank you for taking the time to learn about the carefusion surgical clippers. For more information, visit carefusion.com/clippers or call 523-0502.